But I'm going to introduce you to next Dr. Roberts. Dr. Roberts is our Associate Medical Director. He's also the Associate Director of Research and the Associate Director of our laboratory. So he wears a lot of hats here. Dr. Roberts has become a national and international expert in bleeding disorders, especially in the space of von Willebrand disease. He's really a go-to person now for companies that want to make new and better medications and federal and international organizations that are interested in the science of von Willebrand disease. So Dr. Roberts, as Associate Director of Research, is going to tell you about all the research we have going on here at BCDI.
So wanted to just kind of give you an overview. I mean, we talk about research a lot, and you know, I don't think that we really have a forum other than this to really let the community know what we're up to, and, you know, what we're doing. I think we're trying to do more of that on social media now, letting everyone know, like, when new papers come out and things like that. But this is something besides our primary role of taking care of patients and really trying to, you know, optimize everyone's healthcare. This is what the other part we're doing. So we are very passionate about helping all of you and all of our patients, but also helping patients that we'll probably never see, right? So we're passionate about helping push the research knowledge forward in the community, and really to become national and international leaders in research here too. So I'm going to start with just an overview kind of all the three of us and what we do. And Dr. Espanola is our newest hematologist, and wanted to let you know that even as she has just been starting, she's already hit the ground running and already has multiple publications out that you can see listed here. Some great work that she's done in fellowship on some patients who are post-stem cell transplant and other sickle cell disease and other interesting phenomenons. And actually, as she's already come here hitting the ground running, I was actually asked by one of the editors of one of our international journals, Research and Practice Thrombosis Hemostasis. There's this new type of journal article that's really aimed at educating other clinician scientists across the world, called an illustrated review. So, you know, a lot of the papers that we publish are lots of words and graphs and figures and things like that. But really, it's come to recognize that some things are better put in picture form. And so Dr. Espanola is actually leading an illustrated review on the evolution of hemophilia management, which is going to be very useful for the community. And she's already well on her way and has had good feedback from some of the editors of that journal. And so a lot that Dr. Tarantino just went over, you know, will be published here, hopefully within the next year, of really some of these cutting edge therapies that actually, you know, would be happy to share with you when that comes out. So she's already doing excellent. And this is just a little, excerpt of some of her articles in the Journal of Pediatric Hematology Oncology, in the Pediatric Blood and Cancer. So these are some of our leading journals here, and Dr. Espanola is already doing a fantastic job. So, we certainly can share these if you want to read more of her work, can get that to you. So I do want to also let you know, as you know, Dr. Tarantino has really, you know, our founder and leader of this organization. This has really been a dream of his, and I've worked with him for many years now, both from a patient and professional standpoint. But wanted to just let you know how dedicated he actually is to research. He has over 200 peer-reviewed publications, book chapters, and abstracts. He's regularly invited to speak nationally and internationally. Here locally, we have something where local leaders in research and patient care are nominated. And Dr. Tarantino's not only got the Rock Doc Award in 2010, but then also the Outstanding Alumni Award in 2019. He's been on the national leadership of MASAC, which is the Medical and Scientific Advisory Council of the National Hemophilia Foundation. So that's really for all patients with bleeding and clotting disorders. He sits at the table and helps make recommendations that help push the nation forward in really giving guidance and recommendations for other treatment centers to follow. Also a leader on the Medical Advisory Board for PDSA. For the state of Illinois, the Task Force for Rare Diseases since 2017, so helping policymakers advocate for individuals that are here in the room with rare diseases. Has gotten teaching awards, and he peer reviews multiple journals, and has done a lot of extensive research and continues to do so. One thing that recently have found is helpful in because we have a lot of coming and going and keeping track of what everyone's doing. If you look at Google Scholar, which you can just Google an investigator's name, he has now been cited over 7,000 times in peer-reviewed medical literature. So that means that other doctors have used research that he has done and have cited it as a reference over 7,000 times. And you can see here, this is per year. It only goes back so far, but for 2017, I mean, between 300 to 500 citations a year. So just showing his outstanding leadership for the organization and moving us forward. Some of the other things that has done recently, actually here at BCDI, has led studies in ICP and in the molecule rimiplostim in children that was published in the Lancet, which is one of the leading international journals. You probably have heard of it. Hematologica, another, looking at ITP drug rimiplostim and long-term treatment-free platelet response have become landmark publications in our field. And also I wanted to highlight, it's not just us as the clinicians, the physician scientists that are doing the work, but here, when the COVID pandemic started, we had some patients in the hospital and noted one in particular that had refractory low platelets. That's immune thrombocytopenia. And actually a couple of our nurse practitioners, Jackie Helms and Kristen Anstead, actually helped, Dr. Tarantino, myself as a co-author, describe this. And this has been a paper that's been cited over 50 times of things that can happen after the vaccine, right? And so things that the community needs to be aware of. And this is just an excerpt, because there's obviously each study that we do, there's a lot of nuances, and I just want to give you an overview. But this is even just this year, the different papers that Dr. Tarantino has been involved in that have been published, and that's from Google Scholar as well. And there may be some that haven't been put on there yet, but despite all that we do clinically, I mean, this is other collaborations we have with investigators across the world. Myself, as Dr. Tarantino mentioned, I do work in von Willebrand laboratory assay development and clinical management of disease, as well as hemophilia, goal setting. So the goal heme that some of you may have heard of really trying to hone in on personalization of patient management is actually now being used in Athens. So the American Thrombosis Hemostasis Network, which is one of our national networks, has a patient app called Robust Health, where one of the things that BCDI led as a national study, Goal Heme, really trying to hone in on personalizing therapy and your treatment goals, different things you want to do, becoming autonomous in your own care delivery, maybe exercise and weight loss, different things like that, is being now used in an app for other centers across the country. I also do peer review medical journals and recently been invited as a guest editor for a couple article collections, one in the Journal of Clinical Medicine for hemophilia and another Frontiers in Pediatrics for von Willebrand disease, and have also been making strides in peer reviewed publications as well. Here's just a few of the publications that recently and have been done. Point out again here in the red, this paper that we had published this year, looking at coagulation parameters in extremely premature neonates in our own NICU. So these are babies less than 30 weeks gestation that we were able to characterize previously unknown what their coagulation factor levels were. This was a study that Dr. Tarantino and I worked on since I was a resident, actually. And Rita is one of our excellent laboratory technicians who did a lot of the laboratory work to actually characterize what those patients' factor levels were. And we looked for correlation also with interventricular hemorrhage, which is bleeding in the brain. Here also of the Goal Heme, Sarah Gonzalez, who is our grants manager and our senior clinical research coordinator, she was instrumental in this study, incorporating the patient voice in Goal Heme to advance patient-centered hemophilia care. Again, just, we look at things in the laboratory doing kind of bench research and some of the nitty gritty of the data that Dr. Tarantino was talking about, and then also some of the nitty gritty of how we really advance, patients' treatment overall and holistically, how we advance our patient care. So I want you to understand, we're passionate about kind of all encompassing parts of medicine, not just the laboratory, but also, quality of life and how patients do on the different therapies that they're on. And then this is just showing this year. These are the publications thus far. I have 13 accepted this year and multiple under peer review and other planned submissions that'll happen before the end of the year. So again, a good way besides our social media to keep track of stuff we're doing is looking at our, Google Scholar will have updated what we published recently and such like that. So, this is just a snippet of, now thankfully we're back in person doing presentations, but, Dr. Tarantino also had been recognized as Physician of the Year and Lifetime Achievement in the bleeding disorder community a few years ago. And this is just, other examples of all the speaking we do across the country and across the world. And we're really passionate about what we do. Wanted to highlight here at the end too, this was a few years ago now, but just kind of in bringing together in real time how things happen in pandemics. Even though this was not really a worldwide pandemic, but in people that use synthetic cannabis, if you heard about that in the news a few years ago. So we had patients coming in Central Illinois that were having excessive bleeding from, gastrointestinal tract or urine, even from their nose and eyes and other places. But we recognized, I remember I was in the hospital on rounds, and one of our astute residents, Dr. Kelker, came up to me and said, "We're seeing all these patients. We really don't have a good way to understand what to do. So will you help me review some of the patient charts that are, happening here? And I think it's going to be big news. We could try to get it published in the New England Journal." And lo and behold, we were successful. Got Dr. Tarantino involved as well. And really in downstate Illinois, our group was the first to have named authors in a New England Journal of Medicine publication. That was just a few years ago. That really has served as a reference for other people when patients like this come into the hospital, if they've taken this synthetic cannabis, what the patients present like, what symptoms they have, how to treat them, looking at what we gave with vitamin K and plasma and what patients did, what their laboratory tests were. So really kind of based on us acting quickly and recognizing a need, put together a nice publication that's still used across the world. Just briefly, I only have a few minutes, but we have lots of research going on and lots of ideas in the back of our mind, and it's actually nice to put it all down on paper besides all the other things we have going on. But these are our active study lists. We actually have 16 active studies, and we have a couple that are in review that are possible. But in hemophilia, studies in gene therapy, studies in, if some of you have been approached with the ultrasound study, so looking at joint health over time, and Amanda, our physical therapist, looking at joint health with your ultrasounds at your comprehensive clinic visits. Dr. Tarantino, multiple studies in ITP that we've talked about, some for those patients that are refractory, and this is kind of looking for second, third line therapies to really try to improve platelet counts. Also looking at antithrombin deficiency and thrombosis in von Willebrand disease, looking at von Willebrand disease in pregnancy and what levels do in pregnancy. How do we better treat women through the delivery process? Looking at recombinant von Willebrand factor. So first von Willebrand factor made completely void of all donor blood products like we have for hemophilia. Only until recently was available for von Willebrand disease. And so now we're a site also for kids, and we were a site also for adults with recombinant von Willebrand factor use. And then how von Willebrand factor levels change over time. The ABC von Willebrand age bleed clot study that we're doing as well. We do other observational studies with ATHEN, so the American Thrombosis Hemostasis Network, looking at people that have undergone liver transplants and other rare coagulation disorders, and even more natural history of the course of von Willebrand disease. We have also registry studies. Those of you, if we've at your visit said we'd be part of our CDC study, registry studies, helps really as a national community to understand how patients do on their current therapies. And the ATHEN data set, the Zimmerman project with von Willebrand disease, and then a newer project, ATHEN Transcends, looking at the natural history and safety and effectiveness in a lot of different bleeding disorders actually is in process. Another one that I'll mention in closing, and we'll hand it off to Dr. Espanola, is recently, meaning like in the last year, I was awarded an investigator-initiated research grant for emicizumab in von Willebrand disease. So using what Dr. Tarantino mentioned, the Hemlibra medication, we hypothesized that in people with severe von Willebrand disease or with concomitant bleeding disorder, so having von Willebrand disease and hemophilia, that potentially this underneath the skin subcutaneous therapy will be a good bleeding prevention type therapy. And there's already a lot of national excitement for that. And actually, we're awaiting our final IRB approval, but we'll be enrolling centers across the country even before the end of this year. And then finally, we are very thankful for the support we get from the community and for those that believe in our mission. And the Dills family is one that now we have the Dills Family Foundation Center for Research at BCDI. And they've actually donated over $1 million to help our research program. And thus far, we purchased a new laboratory analyzer and expanded our laboratory capabilities at BCDI. And expanded research funding for our department. So we're very thankful for the Dills family that is helping take us to the next level and even expanding more, as we bring on other staff and other physicians into BCDI to really be a leader across the country and the world in research. So happy to talk more also offline after this talk. But with that, I think I will pass it off to Dr. Espinel.
I want to brag for a second about Dr. Roberts for that. The one study he talked about with the premature babies, he wrote that grant while he was a resident, doing overnight call, raising a young family at the same time. Very rare occurrence and very great accomplishment. And that has 2 publications now from that research that Dr. Roberts wrote while he was a medical or a pediatric resident here. Yeah.